Good morning, everyone. My name is Joy Spencer, and I am the project director for digital food marketing and youth initiatives at the Center for Digital Democracy. The Center for Digital Democracy is based here in Washington, D.C., and we are deeply committed to championing the rights of users, the digital rights of users, and holding corporations accountable in this age where there's constant commercial surveillance and personal data collection for targeted marketing. So in some of our research, we've unearthed and discovered that food marketers are really at the forefront of this new age of data collection and targeted marketing. And specifically, they have turned their attention to communities of color and specifically youth of color, which raises a number of concerns with us because of their intense ability to access youth constantly 24/7 because of the age in which we live, where there is increased use of mobile phones and children have access to screens 24/7. So marketers have the ability to speak to kids constantly on their mobile phones, more so than they did in the age of television, and their ability to receive input from these children to create marketing that is extremely personalized and extremely targeted. And a number of other concerns that we have beyond just that they have this incredible amount of access to children is that they are targeting specifically Hispanic children who are already disproportionately affected by obesity and other obesity-related diseases. And we feel that their access is, they're using their access and exploiting social media and contests and advert games to exacerbate the obesity epidemic amongst communities of color and specifically youth in those communities. And we think that this is something that there needs to be more attention on and more focus on, specifically how companies and corporations can be drawn and held to account for their exploitation of this new digital environment and how we can protect our children in this environment. Thank you.
Thank you. Thank you very much. Let's go through all the speakers, and then we'll get a reaction from the panel. Is that okay? So the next person would be Juan Carlos Aguirre.
Good morning, everyone. My
Good
name
morning.
is Juan Carlos Aguirre. I'm a CEO and executive producer for HTV Studio in Los Angeles. We are a media content production company. My background is not quite academic. I come more from the creative and entertainment industry. Within the last 10 years, we have been designing and producing health communication programs to raise awareness on diseases like HPV, cervical cancer, and colorectal cancer. As a Latino, I'm very concerned about the obesity and overweight crisis in children, and I feel I have to contribute from my trench. We have a vision of empowering the kids to be agents of change, but we are sure that we can do it without your help. And the reason that we are here is to learn from the experts. We are sure that there is enough information about how to alleviate this crisis, but unfortunately, Latino community not all the time understand that information. Our proposal is to create a TV show based on a strong educational content that give the kids and move it to give the kid the tools to change toward the behavioral change to a healthy living, with a simple message in their own language, and they can easily understand and are cultural appropriate. We named that vision "The Kids Take Over," and we would like to show a small video to explain exactly what.
Thank you very much. Mr. Blessings.
Obesity among children doubled over the past.
Our youth are too overwhelming these children better role models.
I'm 13-year-old kids who look like 45-year-olds.
Losing weight is probably a good idea.
The place to focus is on childhood obesity.
We have a crisis in child health right now.
Cuando pienso obesidad, lo que viene a la mente es morbilidad.
I see it as tragic.
We couldn't have done a better job fattening our children over this time period if we had tried.
This may be the first generation where parents are going to outlive their kids.
On the one hand, you have schools, you have parents, you have educators. On the other hand, we have a multi-billion-dollar industry pushing certain messages.
Not only is it making them heavy, not only is it promoting diabetes, it's promoting early heart disease.
That's the scary part of it.
Los que venimos de otro país como de México, por ejemplo, queremos aculturarnos, comer lo que comen acá. Y resulta que eso no es bueno.
Miren nomás qué chulada. Wow.
Si estamos hablando de los hispanos, creo que no existe una educación en general.
Mi niño desde chiquita ya se comía 2 hamburguesas.
Culturalmente existen ciertas cosas que no puedes cambiar.
We like things, you know, fried and it's just bad for you.
They're hungry for information and there's so much out there, they're so confused.
If it was just me and my husband trying to make these changes, it was really hard for us because they don't know the reasons of why.
They need somebody to coach them through the steps on the step-to-step wise on how to make these changes and feel hope that they can make these changes.
People always say what I want to be when I grow up. I always say I want to be the fastest, most strongest, most powerful superhero. I want to be faster. I want to be stronger. Wouldn't it be awesome if somebody would tell me step by step how to be more stronger, faster, and powerful?
Let me tell you about the Kids Takeover. This is a TV show that has a group of health experts, celebrity guests,
and a group of kids like myself. We are now a team and we are taking over.
We are not going to stop there. Our goal is not only to help each other become healthier, but also to invite kids who are watching to form their own team and take control of their health.
Wow!
This is not a competition. This is a movement that can make the difference in the life of many families.
Do you want to be a part of it?
I think empowering children is important. That sometimes we underestimate their ability to find new ways to solve problems, and this truly is a problem.
One, tool that we have at our disposal is to develop content and use the media to educate children.
They really want to do healthy things. They just need to receive those messages in the right manner.
Now we need kids to really understand that this is the food, this healthier food is what they should be eating.
I think it's a moment where the child really is mentoring mom, that mom, I need more.
Que los niños lleven esos mensajes de cómo comer y cómo hacer ejercicio en la casa.
Providing the information in a nice format like that would be very, very good.
Thank you again for that and showcasing Pat Crawford, one of our committee members. So thanks again, very much so. We have one other prepared comment. I may not pronounce this name correctly. Signe Anderson. Okay, is that right, Signe?
That's perfect.
Okay, great. Thank you.
Good morning.
Good morning.
I'm Signe Anderson, Child Nutrition Policy Analyst at the Food Research and Action Center, or FRAC. My colleague, Dr. Heather Hartline-Grafton, provided comments to the committee yesterday, and I wanted to reiterate her point that to truly address child obesity, we must boost economic security and dramatically reduce poverty, hunger, and healthcare disparities in this country. FRAC believes that the federal nutrition programs, SNAP, WIC, school meals, child care, and after-school and summer feeding programs are critical to addressing the nation's hunger and obesity problems. And these are strong programs with a proven record of alleviating food insecurity and improving health. However, these programs aren't reaching millions of low-income children. My job is to focus on the after-school and summer feeding programs, which are among the most underutilized of the federal child nutrition programs. For example, on an average day in 2011, only 2.6 million children had access to the summer nutrition programs, even though 19 million children relied on free and reduced price school lunch on an average school day. So FRAC offers the following recommendations for the committee's consideration. First, increase access to all of the federal nutrition programs, and especially the after-school and summer feeding programs. These are critically important programs for addressing inequities in food access and food security, and I refer you to FRAC's website for specific strategies to improve access. Second, increase access to after-school and summer programming and link them to the federal nutrition programs. There are too few out-of-school programs for children. An increased investment in out-of-school time programming is important to children's health and well-being by itself, but linking the programs closely to funding and standards for physical activity and nutrition will reduce disparities and create a stronger child service infrastructure. And finally, aggressively and quickly implement the child nutrition reauthorization improvements to provide healthier meals and snacks in school, childcare, and after-school settings. These are important programs with well-documented benefits, and the programs will further be strengthened by the recent reauthorization if it's well implemented. So we encourage the committee to review FRAC's resources for additional information on the federal nutrition programs, and I thank you.